Welcome to the Registry Insider. I'm Bill Seifarth, CEO for the National Registry of EMTs. And in today's episode, we're finding out a little bit more about the American Ambulance Association. And joining me is Maria Bianchi. She is the Executive Director and CEO for the American Ambulance Association. So Maria, thanks for joining me for this first episode you've done with us.
Yes, and thank you very much for asking me.
So the AAA, as it's often called, or the American Ambulance Association, is obviously an association that represents folks in EMS. Tell us a little bit about the background, the history, and really what's the main focus and purpose for the AAA.
Sure. So we actually started from the California Ambulance Association, which was the first trade association for ground ambulance services, and they realized they needed a national organization. So the American Ambulance Association was born in 1979, and then we are the National Trade Association for Ground Ambulance Services. We have both governmental and non-governmental members, and our primary purpose is to advocate on behalf of ground ambulance services at the federal level.
So good. So started at a local, state level, blossomed and evolved into a national level, and the main focus is advocacy. As it relates to advocacy, can you give a little bit more in terms of how you do that? Obviously, goes without saying there's some lobbying involved, but it's a lot more than that. And what does that entail for advocacy with the AAA?
There really is a lot more than that. And I'm not a lobbyist. I don't play one on television. I am purely an association management person. But for the AAA, one of the things, what we try to do is gather consensus on actual policies first, because just going up to the Capitol Hill and knocking on congressional doors and getting members involved in meeting their members of Congress, you have to be advocating for something. And usually the better and more specific the ask, the better off you are, rather than just say, we need help. So the AAA has a board of directors made up of different regions. They get together. We have committees who feed them information on specific topics. It could be an operational one. It could be a financial one. And then from that, we create policy. And then either we might introduce legislation. We might find legislation that's already out there that we want to support. And sometimes we also might find legislation out there that our members might consider harmful, and we might then actually have to advocate an alternative to whatever legislation is out there.
So consensus amongst EMS leaders across the country, I'm sure that's a huge undertaking at times.
Yes, I look 60, but I'm actually 20. No, it's a very
yeah,
exactly. It is. But I think we have found over time, whether you're a fire-based service, whether you're private, for-profit, not-for-profit, semi-governmental, whatever your structure is, 97% of everything that we do is the same. Our beliefs are the same. Our value systems are the same. We want to help our patients. We want to help the communities we serve. We want everybody to have the resources they need in order to do so. So we focus on the things that we can agree on. And once we get all of that accomplished in my lifetime, then we can focus on agreeing to disagree. So it's really not as hard as one thinks if you really approach it from that, like putting the patient first. What do our patients really need? And what they really need is they need to know that when there's an emergency, whether it is from a 911 call or it's from a facility because they need to go to a higher level of care, that we are there to serve them, to get them the right care at the right time in the right place in as fast and as safe a way as possible.
So you mentioned that you focus on the 97% where there's commonality, and certainly that pertains to the ground ambulances that you represent. But it's also larger in the EMS community because for the first time in my career in EMS, and it's over 30 years for me, I'm seeing a lot of the national players, the AAA, the NREMT, IFF, IFC, the National Registry, NREMT. So there's a lot of these national organizations coming together, having more of one voice than we've had before. And I think giving us an opportunity for improving the profession, unlike any time I've seen before. So that's exciting. And I think the reason why we can do that is because of the attitude you just said. There's a focus on the 97% that we agree on rather than 3% we disagree. So exciting times ahead, I think, for the profession. So
agreed.
Very exciting.
Agreed.
So going back to the AAA, as it relates to advocacy and on Capitol Hill, where you're meeting with staffers or with legislators themselves, what are some of the top issues that the AAA is working with, either in partnership with others or perhaps on your own to try and advance the EMS profession? What are some of the hot topics right now with the AAA?
I think the first thing really starts with educating.
Mm-hmm.
I don't think that the average person or the member of Congress who is bombarded with every industry, every profession, every group knocking on their door saying, help the paper industry, help this provider community, help, so starting at just the basic level of education and informing the 535 members of Congress as to who we are, what we do, what solution we can play in providing healthcare in this country, how effective that we can be in every geographic area, I think is step number one. I think to know that we exist is one thing, but to really understand how we deliver care can really make a difference. So I think that's the first fundamental goal. And I think that's the goal and the reason why we have consensus of all the groups that you mentioned. I think all of us are like, wait a minute, we better first do our jobs in just educating legislators and regulators on who we are and what we do and the critical role that we play in healthcare. Then after that, I think obviously financial sustainability and thrivability is huge. Everyone is fighting for healthcare dollars right now. We're not Uber. We are not a taxi service. We are providing critical care. Probably in many occasions in very unusual circumstances, we're not institutional care. We don't work in an organization where you open a drawer and know exactly where everything is. We are going to where care needs to take place. So having the financial resources that we need in order to serve our communities is the number one goal. Money is not a four-letter word. It is funding is what is needed in order to provide health care. You can't do it for free. We don't have a universal healthcare system here, although I would say mobile healthcare is a universal healthcare system. We provide care regardless of a person's ability to pay. When you call 911, we show up. And so I think it's critical that the services that we provide get the funding that it needs in order to serve our communities. So that's our number one, always our number one. And I would love for one day not to have to ask, because our services are fully funded and our patients are getting all the care they need. Number two is probably workforce. Everybody is struggling to build their workforce. Generationally, there are differences in how this workforce coming into jobs wants their life to look versus my generation or others. And we have to respond to that and be nimble. And we have to provide, there are many opportunities out there for funding for four-year college degrees, but where are the funding opportunities for trade schools, for EMS, for those things that are so critical? And then number three is probably on the regulatory side. We don't diagnose. We provide care, we stabilize, we move to the appropriate care that they need. And I think one of the things that we struggle with is that right now, on the regulatory side, we are only funded if we transport.
Yeah.
And
most legislators, getting back to your education, don't know that.
They do not, and they are shocked to find out that we can show up, assess, provide care, and a patient can refuse to be transported. And we walk away from there helping the patient, helping the family,
spending resources, using equipment,
and we get $0 back.
So, which kind of goes full circle back to the education piece. There's a lot of I hate using the word ignorance because that it has a negative connotation, but that's the best word. There's a lack of knowledge, a lack of education, a lack of awareness, and it's not through apathy, but it's just they don't know, which is why there needs to be a focus on education, which is why once we educate, then we can say, well, here's the money we need. And oh, by the way, here's what you're alluding to is treatment in place that can and should be thought about and can be done. A hot topic that I know, in addition to treatment in place, is the mobile integrated health, which is another, you say we take care to the community. I heard an analogy yesterday, and we're at the EMS World Expo right now. So presentation yesterday talking about, treatment in place is after 911. Mobile integrated health is before 911. And I like that analogy. That's a great way to look at it. But MIH and community paramedicine has potentially a huge opportunity for our country. And where's AAA with that? I'm assuming similar to what treatment in place and MIH are very similar in terms of hot topics, or how is that progressing from an advocacy perspective?
Well, funny you should mention that. So you started out in this conversation about these groups coming together. Well, the groups came together and have now formed a National Payment Reform Committee. And that National Payment Reform Committee is indeed, and it's made up of the International Academies of Emergency Dispatch, NREMT, AAA, IFF, IFC, all of the groups that have a role in the world that we live in. And they are literally reforming our current, what we would call fee schedule, which is the way the government pays us. And as we know, all of the other payers usually model how they pay in some way, shape, or form on how federal government pays healthcare providers. So our fee schedule was implemented in over 2 decades ago.
Wow.
Without an update or change. So things have changed. So this group is getting together and they are looking at it from A to Z, from soup to nuts. What is it? What is a better way to fund this system? Whether it is, as you said, before the 911 call, whether it is when the 911 call comes in, is there an appropriate place for nurse navigation, or a 911 call comes in, but it's not quite 911, maybe it goes to a different line, to treatment in place, to treatment to an alternative destination, not just a hospital, to an actual ambulance transport. All of that, should we get paid for higher interventions of care? If there is a high cost drug that is new and costs more than the actual reimbursement for the transport, can we get that paid? Are there certain patient populations that need to be funded at a higher level or a lower level? Are there other ways and mechanisms of which we should be funded so it's not just a straight transport plus mileage, and there you go, because the way that we are providing care has changed. The funding mechanism has not changed with it. And
unfortunately, as many situations, the funding is not keeping up with the trends or with the needs.
No.
And 2 decades old reimbursement model seems to be quite outdated. So with medicine, as you know, and medicine is continuing to evolve and improve at a much more rapid pace than previously. And that impacts EMS. I mean, we saw that during the pandemic, but we also have seen, new improvements with resuscitation, with blood transfusions that are initiated in the field. All these are relatively new to the profession, and it's making a difference. And yet we have reimbursement models that are dated and can't keep up with the technology that the public deserves, that the patient deserves. So a lot of challenges in terms of advocacy, but kind of recapping what you're saying, you need to first educate, overcome the misinformation or the absence of information. There needs to be the funding. And that's another thing that the AAA advocates for. There's got to be an understanding in terms of what it is, how we are not only reimbursed, but the treatment and care that we provide so that you can make differences in the communities and more broadly nationwide. So a lot for the American Ambulance Association in terms of what you're undertaking. So where can people go to find out more information? And also, if you wouldn't mind, tell people if they're interested in joining, how they can come about being a member of the American Ambulance Association and finding out all those resources that you have available to members. So
sure. So we have a website, www.ambulance.org. Very easy to remember. And there's a lot of information on there. There's a join button that you can just click and it'll show you how you can fill out the information and become a member. I would also encourage people to join their state associations if they have one. I think that that's a great place to start. We work closely with the state associations, and there's a lot of synergies and a lot of free information available to people out there. We do a lot of webinars, many of which are free. We have a press room and a media page, so the media, if they're interested in finding out more information or want some background on an issue, very easy to go to our website and click on that button as well. And my name and the names of the other staff members are on there, as well as our phone numbers. And I encourage people to pick up the phone and call us. I think it's really, communication is key. And I think there's nothing like relationship building and being able to talk with people one-on-one. I always tell people all the time, whether you pay dues to the American Ambulance Association or not, you're a member. You're a non-dues paying member, because we advocate for all services, regardless of whether you pay us or not. So I would also say that it's wonderful that services do pay us. You should thank any service that's currently a member, because they are the ones that are funding the advocacy work that we do. But remember that we are advocating on your behalf as well. So the one thing that I would say to everybody is get involved. And I don't care if it's with the AAA or NREMT. I don't care if it's volunteering for the registry. I don't care if it's for the state associations or your local rescue squad, but get involved, because we are the ones that are going to make the difference. The boots on the street, the people that are doing this every day, they're the ones the member of Congress want to speak to, not me. They want to meet with the field medics and personnel. They want to meet with the billing staff. They want to meet with the people that are actually doing the work. So every year, NAMT does EMS on the Hill. It's a wonderful event. I would say if you have the time, go to it. Meet with your member of Congress. You don't have to come to DC. They're in their districts. You can be home and you can meet with members of Congress. You can schedule Zoom calls with your scheduling staff and not even leave your own home. They want to hear from their constituents. And all of us as taxpayers, we pay their salaries. They want to hear from us. So there's multiple ways of getting involved. Would love them to join the AAA, but I think really at the end of the day, the only people that are going to solve our problems are us. And the more people that get involved, the louder the voice. As you said, we become a choir. And a really large choir, and that's always going to be louder than a soloist. So I would just encourage people to join, whether at the local, state, or national level.
Very well stated. And one other thing I'll give you as far as awareness too is you have a conference coming up next year.
Yes.
Tell us about that and where that's going to be.
Well, we have two things coming up. I don't want to forget that in November, we have our Stars of Life event.
Yes.
We are going to be honoring 147 ground ambulance service employees and mobile healthcare workers out there. They're coming into Washington, D.C., and we just celebrate them. And they are the most humble, deserving group of people that you would ever want to meet. Most of the time, they don't even know why they're there, because as they say it, I was just doing my job. And it's like, and you are uniquely special because of it. And then in April, we'll have our American Ambulance Association annual conference and trade show at the MGM in Las Vegas. Lots of great sessions, lots of opportunities to learn, to network, to meet with vendors who are so supportive of our profession. And so both of those events are on our website. And I think registration is closed for stars, but not for next year, and open for annual already.
So ambulance.org is the website?
Ambulance.org.
Wonderful. Maria, thank you for joining me for this episode and really giving some great information and insights about the American Ambulance Association, a very important association representing the EMS profession and helping us to move this profession forward and fixing our myriads of challenges that we have. So thank you so much for spending time with me today.
And Bill, thank you for your over 30 years of service, for everything you've done.
Thank you.
Take care.
Thank you as well. And as always, stay safe.
Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.